The hospital hums differently at night. The constant bustle of daytime fades into a focused quietude. As a night shift healthcare worker, you are a guardian of this unique environment. You provide essential care and comfort when the world is asleep. You are a vital part of the healthcare ecosystem. Working the night shift comes with its own set of challenges. One of the biggest is managing the physiological demands of a schedule that runs counter to our natural rhythms. Our bodies are designed to operate on a 24-hour cycle, known as the circadian rhythm. This internal clock regulates our sleep-wake patterns, hormone release, and can impact cognitive function. In this video, we will explore the science behind circadian misalignment and its impact on cognitive performance. We will delve into evidence-based strategies to help you not only survive, but thrive during your night shifts. You are a true healthcare hero. Your dedication and resilience inspire us all. Deep within our brains, in a region called the hypothalamus, resides our internal timekeeper, the suprachiasmatic nucleus, or SCN. This tiny cluster of cells acts as the master conductor of our circadian rhythm. The SCN receives light signals from our eyes and uses this information to synchronize our internal clock with the external world. When we work night shifts, we disrupt this delicate balance. We expose ourselves to light at night, suppressing the production of melatonin, the sleep-inducing hormone. Conversely, we lack sufficient daylight hours to stimulate alertness. This misalignment between our internal clock and our work schedule is known as circadian misalignment or shift work disorder. Studies show that chronic circadian misalignment can have significant health consequences, including an increased risk of cardiovascular disease, obesity, and certain types of cancer. Understanding the science behind circadian misalignment is the first step towards mitigating its impact on our well-being. Our brains are incredibly complex organs, but their optimal functioning relies on a predictable sleep-wake cycle. When this cycle is disrupted, our cognitive abilities are compromised. This is particularly relevant for night shift healthcare workers who are entrusted with making critical decisions and providing life-saving care. Sustained attention, the ability to focus on a specific task for an extended period, is significantly impaired by sleep deprivation and circadian misalignment. This impairment can manifest as difficulty concentrating, making errors, and slower reaction times. Imagine a nurse struggling to accurately calculate medication dosages or a physician missing crucial details in a patient's medical history. These are very real consequences of circadian misalignment. Some individuals believe that they can train their bodies to adapt to night shift work. While there is some evidence of limited physiological adaptation, it is crucial to understand that our core circadian rhythm remains stubbornly entrained to the 24-hour day-night cycle. Even after years of working night shifts, the human body never fully adjusts to an inverted sleep-wake schedule. Studies have shown that night shift workers may experience elevated stress hormones, disrupted sleep patterns, and impaired cognitive performance compared to their day shift counterparts. Strategies for success: minimizing risks and maximizing performance. The good news is that there are evidence-based strategies we can implement to minimize the cognitive and operational risks associated with night shift work. These strategies are not about tricking our bodies, but rather about working with our natural rhythms to optimize our health and performance. One of the most effective strategies is to prioritize sleep hygiene. This involves creating a conducive sleep environment, establishing a regular sleep schedule, and avoiding stimulants like caffeine and alcohol before bed. By making sleep a priority, we can minimize the negative impacts of sleep deprivation. The power of light. Resetting our internal clock. Light is a powerful regulator of our circadian rhythm. By strategically using light exposure, we can help reset our internal clock and improve our sleep quality. Bright light therapy, using a light box that emits specific wavelengths of light, can be particularly effective in shifting our circadian rhythm. During your commute home from work, expose yourself to as much natural sunlight as possible. This will signal to your brain that it's daytime, helping to reset your internal clock. Once you're home and ready for bed, make sure your bedroom is as dark as possible. Blackout curtains, eye masks, and minimizing electronic device use before bed can all contribute to a more restful sleep environment. Sleep hygiene, the foundation of night shift success. Sleep hygiene encompasses a variety of behavioral and environmental practices that promote restful sleep. It's not just about the number of hours you sleep, but also the quality of that sleep. Develop a relaxing bedtime routine that signals to your body it's time to wind down. This could include a warm bath, reading a book, or listening to calming music. Avoid watching television or working on the computer in the hour before bed, as the blue light emitted from these devices can interfere with melatonin production. Fueling the night nutrition and hydration strategies. What you eat and drink can also impact your alertness and cognitive performance during your night shift. Avoid heavy meals that can lead to feelings of sluggishness. Instead, focus on smaller, more frequent meals throughout your shift. Opt for nutrient-rich foods like fruits, vegetables, and whole grains that provide sustained energy release. Stay hydrated by drinking plenty of water throughout your shift. Dehydration can lead to fatigue, headaches, and difficulty concentrating. Avoid sugary drinks and excessive caffeine, which can lead to energy crashes and disrupt sleep patterns. Conclusion: the unsung heroes of healthcare. As a night shift healthcare worker, you are an unsung hero. You provide essential care and compassion when the world is most vulnerable. While the challenges of night shift work are real, understanding the science behind circadian misalignment empowers you to make informed choices that prioritize your well-being. By implementing evidence-based strategies like bright light therapy, sleep hygiene, and strategic nutrition, you can minimize the risks and maximize your performance, ensuring that you are at your best for your patients. Your dedication and resilience are an inspiration to us all. Thank you for watching the Healthcare Motivation channel. If you enjoyed this content, please like and subscribe and share this video with a healthcare hero.